Good evening, everyone. Welcome to yet another edition of continual educational webinar series conducted by Vijaya Diagnostic Center. I am Dr. Hatim, senior consultant biochemist at Vijaya Diagnostic Center, Himayatnagar. First of all, I thank everyone for joining us today. And today we are presenting enzymes in clinical diagnostics. So this topic will be presented by Dr. Manugna. She is our consultant biochemist at Himayatnagar branch, Vijaya Diagnostic Center. So Dr. Manugna has done her MBBS from RIMS Kadapa and MD Biochemistry from Kurnool Medical College, Kurnool. So before starting the presentation, I will ask audience if at all they have any questions, they can type in the control panel or the comment section so that we can take at the end of the presentation. Now, without further delay, I would ask Dr. Manugna to start the presentation. So, Dr. Manugna.
एसी ऑन कर
Yes, good evening everyone. I'm Dr. Manugna, consultant biochemist in Himayatnagar branch, Vijaya Diagnostics, Hyderabad. Today my topic for webinar is enzymes in clinical diagnostics. Enzymes are the special proteinaceous substances that act as the biological catalyst. The name enzyme was given by the scientist Kuhn, which means in yeast. He had discovered it during the process of fermentation in the yeast. Then uh, enzymes are proteinaceous, heat labile substances. They contain 16% nitrogen by weight, and these are specific. Enzymes they play a crucial role in the clinical diagnostics, serving as the powerful tools for the identification and monitoring of various health conditions. These biological catalysts they accelerate chemical reactions without undergoing any change in its structure, enabling the healthcare professionals to gain the valuable insights into the patient's both physiological as well as pathological states. Enzymes can be classified as secretory and intracellular. Secretory are produced by the tissues, namely liver, which have their role in plasma. Examples for the secretory are prothrombin, plasminogen, ceruloplasmin, cholinesterase, and lipoprotein lipase. Next, coming to intracellular, they function intracellularly and they have no physiological role in the plasma. They are membrane bound, for example, alkaline phosphatase and gamma glutamyl transferase, cytosolic, ALT, AST, LDH, and malate dehydrogenase, whereas mitochondrial, AST, glutamate dehydrogenase, ATP synthase, whereas coming to lysosomal, it is acid phosphatase and cathepsins. Next, coming to tissue specific, glucose 6 phosphatase is specific to liver, whereas amylase is specific to pancreas, LDH1 is specific to heart. Let's start with the introduction to enzymes. These are biological catalysts. Enzymes are the proteins that act as biological catalysts, accelerating the chemical reactions in the living organisms. They are essential for life. They are vital for various metabolic processes, enabling the cells to function and sustain the life. Next, structural diversity. Enzymes come in a wide range of shapes and sizes, each designed to facilitate specific chemical reactions. Next, coming to substrate specificity, enzymes are highly selective recognizing and binding to specific substrates to catalyze their transformation. Next, coming to the structure and function of enzymes. Enzymes are the complex protein molecules that act as the biological catalysts, accelerating the chemical reactions in the living organisms without undergoing any change in its structure. They have a unique three-dimensional structure that allows them to bind to specific substrates and facilitate the reaction processes. The structure of an enzyme, it consists of an active site where the substrate gets bind and various amino acid residues that participate in the catalytic mechanism. Enzymes lower the activation energy required for a reaction, enabling them to proceed at a much faster rate. This is the substrate which gets fits into the enzyme at the active site, leading to the formation of enzyme substrate complex, which leads to the enzyme product. Next, coming to the classification of enzymes and nomenclature, enzymes are classified based on the reaction they catalyze, as defined by the International Union of Biochemistry and Molecular Biology. The six major classes of enzymes include oxidoreductases, transferases, hydrolases, lyases, isomerases, and ligases. Examples for oxidoreductases are oxidase and dehydrogenase. Examples for transferases, transferase, kinase. Examples for hydrolases are nuclease and protease. Examples for lyases, decarboxylases and aldolase. Examples for isomerases is isomerase. Ligases, DNA ligase. There is another class which has been introduced in the year 2018 called as translocases. These translocases, they have been belonged to third class, that is hydrolases. Previously they were called as ATPases. Enzyme nomenclature, it follows a standardized system where the enzyme is named based on the catalyzed reaction and given a unique enzyme commission number, that is EC number. Next, coming to the factors affecting enzyme activity. The factors which influence the enzyme activity are temperature, pH, substrate concentration. Let's start with temperature. Enzymes function best at their optimal temperature, that is 35 to 40 degrees centigrade. Temperatures above or below this range leads to denaturation and inactivation of the enzyme. Next, coming to the pH, enzymes have specific pH range in which they are most active. Optimum pH is 5 to 9. Changes in the pH can alter the enzyme structure and leading to the disruption of the function of the enzyme. Next, coming to the substrate concentration, enzyme activity increases with substrate concentration until it reaches a saturation point. Excess substrate may sometimes inhibit the enzyme. Next, coming to the enzyme kinetics and Michaelis-Menten equation, there are two key kinetic parameters that describe the enzyme catalyzed reactions, and about 1 million reactions, enzyme catalyzed reactions per second occur in the biological system. The Michaelis-Menten equation is a fundamental model that describes the kinetics of enzyme catalyzed reactions. It defines the relationship between the initial reaction rate, enzyme, and substrate concentrations, and the two key kinetic parameters, that is maximum velocity Vmax and Michaelis constant Km. Km is the substrate concentration at half the maximum velocity. Characteristics of Km, it is independent of enzyme concentration, it is unique for enzyme substrate pair, and it denotes the affinity of the enzyme towards the substrate concentration. This model, it provides insights into how the factors like temperature, pH, inhibitors can affect the enzyme activity and overall kinetics. Next, coming to enzyme inhibition and activation. The first type of inhibition is competitive inhibition. Here, the inhibitor is the structural analog of the substrate. Inhibitors bind to the active site of the enzyme, preventing the substrate from binding and reduces the enzyme activity. Examples for competitive inhibition include allopurinol, which inhibits the enzyme xanthine oxidase used in the treatment of gout, and ethanol inhibits alcohol dehydrogenase, which is used in the methanol poisoning, and statins, these inhibit HMG-CoA reductase. Next, coming to non-competitive inhibition, inhibitors bind to the distinct site, that is other than the active site on the enzyme, changing its shape and reducing the catalytic efficiency. Next, coming to the examples of non-competitive inhibition, these include fluoride, which inhibits enolase enzyme in the glycolysis. In the conversion of 2-phosphoglycerate to phosphoenol pyruvate, this is an example for non-competitive inhibition. That is why we use fluoride tubes for glucose estimation. Next, coming to allosteric activation, effectors that bind to the regulatory site inducing the conformational changes that enhance the enzymatic activity. Citrate is an allosteric activator of the enzyme acetyl-CoA carboxylase. Next, coming to the diagnostic applications of enzymes. In the clinical diagnostics, enzymes are widely used to detect and measure specific biomolecules, screen for the diseases, and monitor the prognosis. In laboratory testing, enzyme-based assays are staple in medical laboratories, providing rapid, sensitive, and accurate results for a variety of clinical conditions. In the biomarker detection, enzyme serves as an important biomarker indicating the presence or progression of the diseases such as heart failure, liver diseases, and cancer. Coming to therapeutic monitoring, enzyme measurements, the levels of the enzyme help the clinicians monitor the drug effects, optimize the dosages of the drug, and ensure patient safety during the therapeutic treatments. Next, enzymes as biomarkers. Enzymes, they play a vital role as biomarkers in the clinical diagnosis, providing valuable insights into the patient's physiological as well as the pathological states. By monitoring the presence, level of the enzyme, and pattern of specific enzymes, healthcare professionals, they can detect and monitor a wide range of diseases from cancer, liver disorders to cardiac disorders. Next, ELISA. ELISA stands for Enzyme Linked Immunosorbent Assay. Coming to the principle of ELISA, it's an analytical technique that uses the antibodies and color change to detect and quantify specific substances such as proteins, hormones, and antibodies in this given liquid serum sample. Next, coming to the procedure, the ELISA process involves several steps, including coating a plate with capture antibody, adding the sample, and using an enzyme linked detection antibody to produce a measurable color change. Next, coming to the applications of ELISA, ELISA is widely used in clinical diagnostics, drug development, and research to detect and measure a variety of analytes from the infectious diseases to the cancer biomarkers. Advantages of ELISA include it is sensitive, specific, quantitative technique which reduces small sample volumes, making it a powerful tool for the clinical diagnostics and the research. Enzymes employed in ELISA include horseradish peroxidase, glucose oxidase, and alkaline phosphatase. Next, coming to enzyme-based biosensors. These enzyme-based biosensors, they leverage the high specificity and sensitivity of the enzymes to detect and quantify the target analytes. Enzymes are immobilized onto a transducer surface where its catalytic reaction with the substrate, it generates a signal which can be measured in the form of current or light, which is proportional to the analyte concentration. Next, enzyme immunoassays. These are widely used analytical technique in the clinical diagnostics. They rely on specific binding of enzyme label antibodies to the target antigens. Enzyme catalyzes a color producing reaction and the color intensity is measured to quantify the antigen levels in the sample. Next, coming to enzyme based diagnostic kits. These are pre-packaged tools that leverage the power of the enzymes to detect and measure specific analytes in the clinical samples. These kits they streamline the diagnostic process, providing rapid, sensitive, and the reproducible results for a wide range of medical conditions. Advantages include its ease of use, automation, high sensitivity and specificity, cost effectiveness, and rapid TAT, that is turnaround time. Next, coming to applications, enzymatic assays for detecting hormones, proteins, drugs, and metabolites in the blood, urine, and other body fluids. Examples are liver function tests, cardiac biomarker assays, thyroid function tests, and glucose monitoring kits. Next, coming to enzyme linked fluorescent assay, it is a sensitive diagnostic technique that uses the enzymes to amplify the fluorescent signals. Enzymes are coupled to the antibodies or other molecules to detect the target analytes. The enzymatic reaction it produces a fluorescent product which can be quantified with a fluorometer. Enzyme-linked fluorescent assay, it offers high sensitivity and specificity compared to other traditional colorimetric assays. It is widely used in the clinical diagnostics, drug discovery, and biomolecular research to detect low abundance of proteins, nucleic acids, and other analytes. Next, enzyme-linked chemiluminescent assay. It is a highly sensitive technique that uses enzyme catalyzed chemiluminescent reactions to detect and quantify the target analytes such as proteins, hormones, or small molecules. It has a wide dynamic range. The assay can measure a broad range of analyte concentrations, making it suitable for a variety of clinical diagnostic applications. It is rapid and automated. Enzyme-linked chemiluminescent assay is often automated, providing fast, high-throughput analysis with minimal hands-on time, improving the efficiency and turnaround time in the clinical laboratory. Next, coming to its enhanced specificity, the combination of enzyme labeling and chemiluminescent detection, sorry, it enhances the specificity of the assay, reducing the risk of the false positive result. Next, coming to enzyme-based point-of-care testing, it helps in rapid diagnosis. Enzyme-based point-of-care tests, these enable quick and accurate diagnosis of various medical conditions at the patient bedside or in emergency room or in a clinic, OPD clinic, without the need for a centralized lab. These are portable devices. These tests utilize the portable handheld devices that can detect and measure specific enzymes in small samples of blood, urine, and other bodily fluids, providing the immediate results. Improved outcomes, the rapid nature of the enzyme-based point-of-care testing, it allows for faster clinical decision-making, leading the clinicians to early interventions and improved patient care, particularly in time-sensitive situations like emergencies. Next, coming to its convenience, point-of-care testing, it eliminates the need for the sample transportation and waiting for the results from the centralized lab, making it more convenient for both the clinicians as well as patients. Next, enzymes in therapeutic drug monitoring. Therapeutic drug monitoring, it's a crucial clinical application of enzymes in diagnostics. Enzymes are used to measure the levels of various drugs in the patient's blood or other body fluids, ensuring the optimal dosing and preventing the adverse effects. By leveraging the enzyme-based assays, clinicians they can closely track the pharmacokinetics and pharmacodynamics of the medications, leading to personalized and effective treatment plans. Next, coming to the enzymes in the liver function test. Enzymes they play a crucial role in assessing the liver health and its function. Elevated levels of liver enzymes like transaminases, alanine transaminase and aspartate transaminase, these are the markers for hepatic injury. These can indicate the liver injury. These are routinely measured in the liver function test to help the diagnosis and monitor conditions like hepatitis, cirrhosis, and liver cancer. And markers of cholestasis include GGT, 5' nucleotidase, and alkaline phosphatase. Next, coming to the enzymes in cardiac biomarker assays. For the troponin test, cardiac troponins, troponin I and T, these are the crucial biomarkers for detecting the myocardial injury, enabling the early diagnosis of acute myocardial infarction. Next, coming to creatine kinase, MB. Creatine kinase MB, it's an isoenzyme of creatine kinase, is a sensitive and specific indicator of cardiac muscle damage, complementing the troponin test for comprehensive cardiac assessment. Next, coming to lactate dehydrogenase, LDH levels, they can help to differentiate between myocardial infarction and other causes of chest pain, providing valuable diagnostic insights. However, LDH is obsolete nowadays. Enzymes in renal function tests. Enzymes, they play a crucial role in the assessment of renal function, providing valuable insights into the health and performance of the kidneys. By monitoring the specific enzyme levels, the clinicians can detect and monitor various kidney related disorders, including AKI, CKD, and renal tubular dysfunction. Three enzymes, they play a crucial role, which include lactate dehydrogenase, alpha glutathione transferase, and gamma glutamyl transpeptidase. And 20% increase in the enzyme levels can indicate underlying renal damage, prompting further investigations and the appropriate treatment. Enzyme based renal function tests, they can be highly sensitive, where the sensitivity is 90%, often detecting the abnormalities before the traditional biomarkers like creatinine or blood urea nitrogen. Next, enzymes in pancreatic function tests include amylase, lipase, and trypsin. Amylase is an enzyme that breaks down the starch into smaller sugar molecules. Elevated levels indicate pancreatitis and salivary gland tumors. Lipase is an enzyme which is specific to acute pancreatitis. It's a enzyme that breaks down the fats. Elevated levels are the key indicator of acute pancreatitis, providing valuable diagnostic information. Trypsin is an enzyme that aids in the digestion of proteins. Trypsin levels can help us to assess the pancreatic exocrine function and detect the pancreatic insufficiency. Next, coming to enzymes in bone and muscle disorders. In bone disorders, enzymes like alkaline phosphatase and tartarate resistant acid phosphatase, these are used to diagnose conditions affecting the bone metabolism such as Paget's disease, osteoporosis, and bone tumors. Next, in the muscle disorders, creatine kinase, lactate dehydrogenase, and aldolase, these are the key enzymes that help us to identify the muscle damage and diseases like muscular dystrophies, rhabdomyolysis, and viral myositis. In joint disorders, hyaluronic acid and glycosaminoglycan degrading enzymes aid in the diagnosis of joint related conditions like osteoarthritis, rheumatoid arthritis, and gout. Next, role of enzymes in neurological disorder diagnosis. There are certain enzymes which play a crucial role in the diagnosis of the neurological disorders. For instance, lactate dehydrogenase and creatine kinase, they indicate the brain damage, while acetylcholinesterase levels, they can help in detect the conditions of Alzheimer's disease. Enzyme based tests, these offer valuable insights into neurological function and dysfunction. Next, coming to enzymes in cancer biomarker detection. Tumor markers, enzymes can serve as valuable cancer biomarkers indicating the presence and progression of certain types of tumors. These enzyme-based biomarkers, they can help with early cancer detection and monitoring the prognosis. There are few enzymes which are used as tumor markers: alcohol dehydrogenase and aldolase. These help in the diagnosis of carcinoma of liver, alkaline phosphatase, bone, liver, leukemias, and few sarcomas. And amylase is specific to pancreatic carcinomas, esterase, carcinoma of breast, neuron-specific enolase, small cell carcinoma of lung, neuroblastoma, melanoma, pheochromocytoma, and 5' nucleotidase in the carcinoma of liver, prostate-specific antigen and prostatic acid phosphatase in the carcinoma of prostate. Diagnostic applications, enzyme-linked immunosorbent assays and other enzyme-based tests, these are widely used to measure cancer-associated enzymes in the patient sample, aiding in the cancer diagnosis, prognosis, and the choice of treatment. Next, coming to activity monitoring, tracking changes in the activity levels of certain enzymes. These can provide insights into tumor growth, invasion, metastasis, helping the clinicians to evaluate the disease progression and effectiveness of the cancer therapies. Enzymes in infectious disease diagnosis, they play a crucial role in the diagnosis of the infectious diseases which are caused by bacteria, viruses, and fungi. In the viral infections, in the detecting of viral enzymes for diagnosis, bacterial infections for identifying the bacterial enzyme markers, and in fungal infections, monitoring the enzymatic activity of the fungi. Next, coming to the challenges and limitations of enzyme-based diagnostics. These enzyme-based diagnostics tests, they face several challenges, including the interference from other substances, presence of inhibitors or activators. They can impact the enzyme activity. Next, coming to the stability, enzymes may degrade over time, affecting the reliability of the test. And lack of specificity. Enzymes may cross-react with similar molecules, reducing the accuracy. These factors can compromise the accuracy and reliability of the test results, limiting their clinical utility. Next, coming to the emerging trends in enzyme-based clinical diagnostics. As the field of clinical diagnostics, it continues to evolve. Several emerging trends in the enzyme-based testing have emerged. These include development of more sensitive and specific enzyme assays, the integration of enzyme-based biosensors with the digital technologies, and increasing the use of enzyme-based point-of-care testing. Sensitive enzyme assays, advanced enzyme assays with improved detection limits and enhanced specificity are being developed, enabling the early diagnosis and monitoring of various diseases. Enzyme-based biosensors, the integration of enzyme-based recognition elements with the digital platforms such as smartphones and wearable devices is enabling rapid on-site testing and real-time monitoring of the health conditions. Next, coming to point of care testing, enzyme-based diagnostic kits and portable devices, these are becoming more prevalent, allowing for the decentralized testing and faster decision making in the clinical setup. These emerging trends in the enzyme-based diagnostics, these are expected to drive the advancements in the personalized medicine, early disease diagnosis, and the prognosis of the patient. Next, coming to the regulatory considerations for enzyme-based diagnostics. Enzyme-based diagnostic tests, these are subjected to rigorous regulatory oversight to ensure safety, efficacy, and reliability. Manufacturers, they must adhere to stringent guidelines set by the governing bodies like FDA, EMA, and ISO to obtain the necessary approvals and certifications. Key regulatory aspects, they include clinical validation, quality control, manufacturing processes, and post-marketing surveillance. Adherence to the good laboratory and manufacturing practices is crucial to meet the regular standards. To meet the regulatory standards, these are crucial. Next, coming to future directions and research opportunities, expanding the enzyme applications, explore new diagnostic and therapeutic uses for the enzymes, leveraging their unique catalytic properties and their high specificity. And in developing novel enzyme based assays, innovate enzyme detection methods such as electrochemical, optical, and microfluidic platforms to improve the sensitivity, speed, and the portability. Next, in integrating the enzymes with emerging technologies, combine enzymes with artificial intelligence, machine learning, and lab-on-a-chip devices to create next-generation diagnostic tools. And in exploring enzyme engineering, utilize the protein engineering and directed evolution to design the customized enzymes with enhanced stability, activity, and specificity. Next, coming to the conclusion and take home message. Enzymes, they play a pivotal role in clinical diagnostics, serving as crucial biomarkers and enabling the advanced testing techniques in that provide valuable insights into the health conditions, various health conditions. Next, expanding diagnostic capabilities. As our understanding of enzyme deepens, we continue to uncover new diagnostic applications, driving advancements in personalized medicine and early disease detections. While enzyme based diagnostics face some challenges, innovative solutions and ongoing researchers are addressing specificity, sensitivity, and other limitations to enhance the reliability and accessibility of these essential tools. Future prospects. The future of enzyme based diagnostics, it holds tremendous promise with the potential to revolutionize the clinical decision making, improve the patient outcome, and advance the overall field of healthcare. Thank you all for your patient listening. Thank you.
Thank you, Dr. Manugna. That was a very informative and elaborate session. The presentation. I think we have some queries here. One of the question is enzymes used in rDNA technology. So, what are the different enzymes in DNA technology?
Yes, sir. The enzymes which are used in rDNA technology are thermus aquaticus polymerase, restriction endonucleases, and DNA ligases. These are
Okay,
employed in rDNA technology.
any enzymes used in ELISA?
ELISA, we use alkaline phosphatase, horseradish peroxidase, and glucose oxidase.
Okay. Other queries are like enzymes used in any carcinomas. Enzymes as tumor markers in carcinomas. Any specific
Yes.
carcinoma like liver or prostate?
Coming to carcinoma of liver, alcohol dehydrogenase, aldolase, gamma glutamyl transaminase, alkaline phosphatase, and 5' nucleotidase. These are used in diagnosing the carcinoma of liver. Next, coming to carcinoma
Prostate.
of prostate, we use prostate specific antigen, prostatic acid phosphatase, and neuron specific enolase. It is used to detect melanomas, pheochromocytoma, and neuroblastoma.
Okay. I have one more query. Any isoenzymes of creatinine kinase or LDH? Like as you
Yes, sir.
said, creatinine kinase, CKMB and all CKMM. I think
Yep.
CKMB we can use as a cardiac marker. Yes.
CKMM for muscle, sir,
Yeah. MB for
and
cardiac.
MB for
Yes.
cardiac and BB
BB for brain
for
using.
brain. Yes.
The most common among this is CKMB, where for any patient who is having any cardiac related issues like coronary heart disease, acute coronary syndrome. So, along with the troponins and other radiological and ECG, we order CKMB. So, immediately, whenever there is injury to the cardiac muscle because of any decrease in blood supply due to atherosclerosis or any formation of thrombus, these enzymes get elevated. So, especially CKMB, which is isoform of creatinine kinase. So, likewise, we have some isoenzymes of LDH also. There are five
LE
isoenzymes.
1,
Yes,
2, 3, 4, and
yeah,
5.
different. So one of the viewer he has asked about these enzymes. So that's why I thought of discussing this. So that's it. We don't have any more queries. Thank you, everyone. Thank you once again, Dr. Manugna. That was a very elaborate presentation. And for everyone, who has joined us. Thank you very much. And just a reminder, we have the recorded version of this presentation available in YouTube, LinkedIn, and Facebook. If at all you want to go through, you can go through in the near future. So thank you everyone for joining us today, and meet you in the next session of Vijaya Diagnostics session. Thank you.